my God, my water has broken.
The quadratus lumborum and rectus abdominis is used by a pregnant mother to alleviate pressure on her spine as well as stabilize her core. The quadratus lumborum muscle originates at the iliolumbar ligament and the internal lip of the iliac crest. It inserts at the transverse process of the L1 to L4 vertebrae and the inferior border of the 12th rib. Its normal functions include fixing the 12th rib during respiration and allowing one to laterally flex their trunk. But during pregnancy, a mother's center of gravity has shifted, so it contributes to the stabilization and movement of the spine and the pelvis. The rectus abdominis muscle originates at the crest of the pubis and the symphysis pubis. It inserts at the xiphoid process of the sternum and costal cartilage of the 5th, 6th, and 7th rib. The rectus abdominis is a paired muscle running vertically on each side of the anterior wall of the human abdomen. It is separated by the linea alba. Each muscle consists of a string of 4 fleshy muscular bodies connected by a narrow band of tendons, which give it a lumpy appearance when well defined and tense. This muscle is used in everyday actions such as during bowel movements and coughing, but most important, it is used by a mother when a child is being delivered. When giving birth, a mother will tense her rectus abdominal muscle, causing the compression of the abdominal contents. It also assists with breathing and plays an important role in respiration when forcefully exhaling. Diastasis of the rectus abdominal muscle may also occur. This is when the connective tissue of the linea alba disappears. The separation in the muscle allows what's inside of the abdomen, mostly the intestines, to push through the muscle. This forms a bulge. This is because the growing uterus puts pressure on the abdominal muscles, causing them to stretch and separate.
You got it, ma'am. You got it, ma'am. I got it, ma'am. Ma'am, we're going to need you to breathe. Shut up!
As you can see, our patient is breathing heavily right now. To do this, our patient is using certain muscles for this process. One muscle includes the transverse abdominal muscle. This muscle's origin is in the costal cartilages of lower ribs, processes of lumbar vertebrae, lip of iliac crest, and inguinal ligament. The insertion includes the linea alba, which runs from the xiphoid process to the pubic symphysis and the crest of the pubis. Its main action is it tenses the abdominal wall and compresses abdominal contents. This specific muscle is primarily used for heavy breathing during labor. For example, while maintaining a flat back on the delivery table, our patient inhales, releasing the muscle tone of the belly, and then exhales, which contracts the transverse abdominal muscle. A similar muscle to the transverse abdominal muscle is the diaphragm. The diaphragm is a muscle that separates the thoracic cavity and abdominal cavity. It is to help the body inhale and exhale air, which helps during the heavy breathing involved in childbirth, as well as active pushing. Its main action is inspiration and assist in raising intra-abdominal pressure. The insertion is the central tendon. The diaphragm's origin includes the vertebral, which is the crural from bodies of lumbar 1 and 2 on the left, lumbar 1 through 3 on the right. In costal, medial and lateral arcuate ligaments, inner aspect of lower 6 ribs, and in the sternal, 2 slips from posterior aspect of xiphoid.
When the patient is being asked to push, both the abdominal external oblique muscle as well as the abdominal internal oblique muscle are being used. The origin for the abdominal external oblique muscle consists of the outer surfaces of the lower ribs. Its insertion is the outer lip of the iliac crest and the linea alba. Its action is to tense the abdominal wall and to compress abdominal contents, and note that this muscle is used during active pushing. The abdominal internal oblique muscle's origin consists of the crest of ilium and inguinal ligament, which are both located near the hip. Its insertion consists of the cartilage of the lower ribs, the linea alba, and the crest of pubis. Its action is to tense the abdominal wall, as well as to compress abdominal contents, and like the abdominal external oblique muscle, this muscle is also used during active pushing.
Push!
Some viewers may find the following video disturbing. Viewer discretion is advised.
During childbirth, the patient engages the levator ani. Its origin is in the pubic bone and the ischial spine. Its insertion is in the coccyx. Its action supports pelvic viscera and provides a sphincter-like action in the anal canal and the vagina. During childbirth, portions of the levator ani stretch up to 3 times, which not only can potentially cause pain, but the strain can result in damage or even complete disruption and detachment of the levator ani muscles from their insertion points on the pubic symphysis. Also, during the second stage of labor, excess stretching of a portion of the muscle results in a stretch of its nerves, which can permanently damage the nerve. The levator ani is aided by the coccygeus in this process. Its origin is in the ischial spine and its insertion is in the sacrum and coccyx. Like the levator ani, its action is that it supports pelvic viscera and provides a sphincter-like action in the anal canal and the vagina. As you can see here, along with the levator ani, the coccygeus makes up the pelvic floor as well as supports the fetal head during birth.
Guess what, ma'am? It's a girl.
Oh my God, it's so
Congratulations.
cute. Amanda, look at our creation. Amanda?
Who left you this note?
What do you read? It ain't yours.